Hi, I'm Dr. John Wang. I'm a vascular and endovascular surgeon with Advanced Vascular and Endovascular Clinic and also PanAsia Surgery. Today we're going to talk about why diabetes is an important healthcare problem and what has it got to do with feet. Diabetes is one of the leading causes of chronic diseases, currently affecting more than 463 million people worldwide. Its incidence is on the rise and is predicted to soar to 578 million globally by 2030 and 700 million people by 2045. The WHO projects that diabetes will be the 7th leading cause of death by 2030. Most people are aware of the 3 major complications of diabetes that contribute towards mortality, mainly myocardial infarction or heart attack, stroke, or renal failure requiring dialysis. Less know about the debilitating and threatening effects of diabetes on the lower extremities. Every year, more than 1 million people lose their legs because of diabetes. This means that every 20 seconds, an amputation occurs somewhere in the world as a complication of this devastating disease. Diabetic foot disease is common, and its incidence will only increase as the population ages and our obesity epidemic continues.
How does diabetes affect my foot?
Diabetes affects patients' feet in 4 major ways: peripheral arterial disease, diabetic neuropathy, feet deformities, and also reduced resistance to infection, and we'll be talking about this in turn. The first of which is peripheral arterial disease. Peripheral arterial disease, or PAD, is the process of arterial sclerosis, where cholesterol deposits abnormally in the wall of the vessels, causing bulky narrowings and also blockages. This leads to reduced blood flow to the limb, especially the legs. When the blood flow is so poor, it can become critical, and that's what we call critical limb-threatening ischemia, and these can present with ulcers or gangrene. If not recognized or treated in a timely fashion, it can pose a 20 to 40% risk of limb loss, patients requiring amputation of the legs. Diabetes accelerates arteriosclerosis and peripheral arterial disease, and it predominantly affects tibial arteries in the legs, both of which pose significantly higher risk for CLTI and limb loss. The second condition is diabetic neuropathy. Poor diabetes control can lead to nerve damage or diabetic neuropathy. The nerves to our legs and feet are the longest in our body, and they're the most susceptible. About half of all people with diabetes has some kind of diabetic neuropathy, which can cause numbness, tingling, increased sensitivity to pain, or it may lower your ability to feel heat, cold, or pain. Now, inability to feel pain may sound pretty good, but it comes at a high cost. Pain is the body's natural way of telling you something is wrong, so you can take care of yourself. If you don't feel pain in your feet, you may not notice a cut, blister, sore, or wound. Small problems can then become serious if they aren't treated early. Thirdly, there are feet deformities. If autonomic nerves are involved in diabetic neuropathy, the abnormal or reduced tone within the intrinsic muscles of the feet can lead to change in shape and structure that compromise weight bearing and walking. Loss of foot arches and club-shaped deformities such as Charcot's foot can lead to abnormal weight-bearing areas and pressure points within the footwear, rendering them susceptible to injury and wounds. And lastly, reduced resistance to infection. While high blood sugars or hyperglycemia are well recognized to cause immune suppression, even well-controlled diabetics are immune compromised to a certain degree. Diabetes has the effect of rendering white blood cells less vigorous in combating infections. Consequently, infections do not resolve quickly, overwhelms easily, and spreads rapidly. Now, the combination of peripheral arterial disease, diabetic neuropathy, foot deformities, and impaired ability to fight infections are potent contributors towards limb loss. Lack of blood flow will render the limb susceptible to ulcers and gangrene, which patients are not aware of or are not bothered by due to the lack of pain from diabetic neuropathy. Once present, infection can set in, spread quickly to threaten both life and limb. If made to choose between losing life or limb, usually the limb is sacrificed. We'll check your feet daily for cuts, redness, swelling, sores, blisters, corns, calluses, or any other change to the skin or nails. A pair of eyes need to inspect them every day. Use a mirror if you cannot see the bottom of your feet, or ask a family member to help. Seek medical attention from your family doctor or general practitioner early if you spot any problems. Feet hygiene is important. Wash your feet every day in warm, not hot water. Don't soak your feet. Dry your feet completely and apply moisturizing lotion to the top and bottom, but not between your toes, which could lead to infection due to the dampness that accumulates. You may apply a sprinkle of cornstarch powder between the toes to keep them dry. Wash off, dry adequately, and reapply daily if desired. Avoid talc powder due to the concerns of carcinogenicity. Never go bare feet. Always wear shoes and socks or slippers, even inside the house, to avoid injury. Check that there aren't any pebbles or other objects inside your shoes and that the lining is smooth. Avoid slippers when outdoors, as shoes provide superior protection from external injuries. Wear shoes that fit properly. Shoes that are too tight or too loose can both cause injury and wounds. For best fitting, try on shoes at the end of the day when your feet tend to be the largest. Break in your new shoes slowly. Wear them for an hour or two a day at first until they are completely comfortable. Always wear socks with your shoes. Choose clean, lightly padded socks that fit well. Socks with no seams are the best. Walking shoes and athletic shoes are good for daily wear. They support your feet and allow them to breathe. Do not wear vinyl or plastic shoes because they do not stretch or breathe. If you have a bunion or hammer toes, which are toes that curl underneath your feet, you may need extra wide or deep shoes. Do not wear shoes with pointed toes or heels because they put too much pressure on your toes. Trim your toenails straight across and gently smoothen any sharp edges with a nail file. Doing this can prevent ingrown toenails and wounds. Do not trim them too close to the nail bed, as this may incur an injury and a wound. Have your foot doctor or podiatrist trim your nails if you can't see or reach your feet. Do not remove calluses or corns yourself, and especially do not use sharp instruments such as scissors, nail clippers, or blades that may cause open wounds. Over-the-counter products are discouraged as they could burn your skin. Protect your feet from hot and cold. If you have diabetic neuropathy, you may burn your feet and not know you did. Wear shoes at the beach and on hot pavements. Put sunscreen on the top of your feet to prevent sunburn. In cold weather or climate, keep your feet away from heaters and open fires. Do not put a hot water bottle or heating pad on your feet. Get your feet checked at every healthcare visit. Also visit your foot doctor or vascular surgeon every year, more often if you have nerve damage, for a complete examination, which will include checking for feeling, meaning nerve function, and also blood flow into your feet. Also choose feet-friendly activities like walking, riding a bicycle, or swimming. Check with your doctor about which activities are best for you and any you should avoid.
What are the telltale signs and when should a patient seek medical attention?
If you experience any of these symptoms, don't wait for your next appointment. See your regular doctor, a foot doctor, or a vascular surgeon right away. These symptoms include pain in your legs or cramping in your buttocks, thighs, or calves during physical activity, tingling, burning, or pain in your feet, loss of sense of touch or ability to feel heat or cold very well, a change in the shape of your feet over time, loss of hair on your toes, feet, and lower legs, dry, cracked skin on your feet, a change in the color and temperature of your feet, thick, yellow toenails, fungal infections such as athlete's foot between your toes, and a blister or sore or ulcer or any infected corn or ingrown toenail. Importantly, good blood sugar level control is imperative for healthy feet, along with other medical and lifestyle modifications for good health. For example, compliance with diabetic medications, adherence to a diabetic diet, smoking cessation, regular exercise, and avoidance of excess body weight. Regular home blood sugar self-testing is prudent and should target random blood sugar of less than 11 millimoles per liter and fasting blood sugar of less than 5.6 millimoles per liter. Longer-term goals should aim for a hemoglobin A1C of less than 7%. Most people with diabetes can prevent serious foot complications and limb loss. Regular care at home and going to all doctor's appointments are your best bet for preventing foot problems and stopping small problems from becoming serious ones.